Hello, this is Mr. Mercado, and we're going to be going over a clinical packet example. Just wanted to review the areas of the packet itself that I want you to fill out and give some more, clarity on exactly kind of what we're looking for in these packets. So I'll walk over them with you here. Some may look a little different depending what class you're in, but they're all basically the same. Okay, I want to start off by saying this clinical packet is it's based about 75% of this packet on your physical assessment. So you got to perform a physical assessment on your patient. Okay, make sure your name, date, course, name and number is on here. That's the first page. This will be here, the demographic and neurological page. Here is you need to have this entire top portion filled out. So for the demographics, remember with HIPAA, you do not need to place patient's name up here. Do not do that. You can put initials or patient age and sex, that's fine. Very important, make sure you have your admit diagnosis in here. Okay, you can find that in the charts. Okay, if you're not sure where to find that, ask your nurse. Okay, you can find that in the electronic charts. If you are somewhere that still has paper charts, you should be able to find it there. Okay, you can look at history and physical notes by the admitting doctors. You should be able to find those. Okay, what are their allergies? Do they have allergies? Or are there no known drug allergies? Height and weight, very important here. This is just an example. You need to have the patient's medical surgical history here as well. Okay, again, very important. Code status. They DNR, DNI. What code do they have? Okay, are they on isolation? Okay, contact, airborne. Okay, droplet. Make sure you put that down. Another very important thing, diet. Okay, you need to know your diet because patients will ask you for something to drink or ice. What if they're NPO for a surgical procedure? You did not find that out and you go ahead and give this patient that's been bugging you for 2 hours for something to drink or eat. And they had surgery scheduled or some type of diagnostic or some type of scheduled procedure I need to get done. Also ensure, okay, that you also have the vital signs, okay? You could just have at least one set of vital signs, but the first vital signs you get will be fine here for that patient. Okay, blood pressure, where was it done? Respirations a minute, pulse a minute, all right? Heart rate. What's the O2 sat? The temperature and the route of that temperature. Okay, was it oral? Was it axillary? Was it rectal? Okay. All right. Neurological assessment. That's a mental status exam as well. Are they alert and oriented person, self, place, time? They're lethargic, comatose. All right, go to communication of speech. Pupils, are they perla? Make sure you're filling this out. Pupil size. Other thing too is this Glasgow coma scale. Okay, you fill these individual sections out, but you need to put your total here. Okay, make sure you do that. This is mirroring the actual charting you're going to be doing in a hospital environment and those EHRs. Okay, if you've had a chance to look at them, or you probably will, you see how close it is aligned to the charting you will do as an RN. Okay, this is part of those. You'll be doing this as an RN as well. And then global deterioration scale, fill that out as well. Score 4 or higher is usually considered to be indicative of dementia. Okay, look at those clearly and fill that out. And then here we need to make sure that you are assessing the musculoskeletal, right? The muscle strength. The equality of strength here between right and left for hands, upper extremities, lower extremities. Are they greater than, less than, or are they equal? You can put that here. This will be related to the hands, upper, lower extremities. Same thing with sensation. Okay, no response to pain or to touch to pain. Tremor present, yes or no? All right. Are they ambulatory? Now, some of these I'm going to have some examples here. I'm right in there for you so you can kind of take a look at what we're expecting. Okay, there's gait, describe gait in one of the sections. Steady, ambulates independently. They do not have any assistive devices, no cast. But if they had a cast, you want to fill this out. If they don't, they need to put no or NA on there. Same thing with respiratory. Put your pulse ox number. All right. Assess their oxygenation. Are they on room air? Do they have nasal cannula, etc.? Cough, sputum. What's their respiratory rate and their effort? Remember, this is part of your respiratory assessment. So where you see the highlighted areas, you need to fill out each section. Do not leave them blank. Where are the breath sounds? Describe them where they're auscultated. Cardiovascular. Fill out all these sections. Okay, what is temperature? Okay, skin, then skin turgor. Make sure you check the optical pulse. Is it regular? Regularly irregular, irregularly irregular. Heart sounds, the rate. Another important area is peripheral pulses and edema. This is, you need to check all of these off. Okay, make sure you do your assessment. You have to check all these areas off. Okay, GI. Same thing here. Are they continent? What's going on? Is the urine amount as expected? Remember, 30 per hour is the minimum. They have to have a cath. You have a cath size. Okay, look at these areas closely. Make sure you're looking at them and filling them out. GI. Same thing here. Oh, it's not highlighted. I will do that now. Date of last bowel movement. Please make sure that is filled out. That is a question that all staff is going to be asking throughout the day. Your patients may be sick of that question, but we have to know when their last bowel movement was. Another very important part, especially being a nurse, is assessing I's and O's. So the intake and output for your shifts. Okay, all intake, IVs. All right, give them a cup of ice, figure that one out. All right, you give them a cup of juice, figure those out. Okay, all in milliliters. Then the output totals itself. All output, all input. Then your fluid shift balance, or your shift fluid balance. Excuse me. So your output's greater than your input, you're going to have a negative balance there. Okay, skin integrity. What you can do here as well, you can write on these. Okay, you can do them on your computer as well. Highlight, or you can check them or X them, that's fine. But if they have any skin issues, make sure you're writing on the body itself where exactly it is. Describe it. Let's see all that here. Okay, I'm just walking you through so you know what we have to get done here. Where exactly we want you to put these things. Remember, do the entire assessment. Pain assessment as well. If they have no pain, unreported, you just want to highlight this, you'll be done with that section. But if not, describe where it's at. What is it affecting? The description, you see that all here. What makes it worse? What makes it better? Any pain medication? In this example, they have a PCA pump. Or excuse me, no, I did not put the PCA pump, excuse me. Think of it any medication here, whatever is in their chart. What's the route last dose? Okay, IV assessment. Here, you want to make sure you understand and you find out when was the IV placed, what date. Okay, could have been done when you were on shift. Okay, you could have placed it. That's fine. Make sure you're putting that on there. Where exactly was the IV inserted at? This example is the left forearm. Okay, 20 gauge left forearm. It is clean, dry, and intact. Saline locked. Okay, any additional vital signs? If you have to take frequent signs, you can put them here. In addition to the one you put on the first page under demographics. It's another important section that every class I have a couple of the same examples. This is not a place where you're going to put high, low, normal. We are definitely aware of that. And the funny thing is, here are your values. So if you have a 12, for example, here for the white blood cells, we see the values are 5 to 10 as normal per college, per the Galen College of Nursing, right? You put 12, I don't want you to put high. We are all well aware it's high. But what would 12 indicate? It's possibly an infection. Okay, this is an example. Hemoglobin 6.1, that's pretty low. So an interpretation could be bleeding suspected. Patient is post-operative day 2. Okay, A1C, we have a 7-1 here as an example. And as, excuse me, as an example. The interpretation, what is your interpretation of that? Well, they have a diagnosis of diabetes. The diabetes is probably poorly controlled, not controlled. Okay, some of these are the very easy examples, but I want to go through that. 221 glucose, same thing here. Have your interpretation of what you believe that means for this patient, especially how it correlates to why they're here. What's their admitting diagnosis? What's going on? Okay, have it correlate to their medical history. They have a current diagnosis or history of diabetes. Want to make sure if we see these numbers, just what it's correlating to. It makes more sense now, right? Well, they have diabetes. Look at these numbers, poorly controlled. Creatinine, well, technically they may not have a kidney diagnosis for any issues, but they could be very dehydrated. Okay, the illness itself could have created an acute kidney injury, so possible AKI. And you can fill out as many abnormal labs that are in here. Make sure you do have at least 3 or 4 in there, please. Okay, urinalysis as well. You have ABGs, additional labs here, D-dimer, bilirubin. You have some cardiac enzymes in here as well. Same thing, put the results. What's the interpretation? Okay, other labs here may not always have this, but you may have results for X-rays, CTs, MRIs. Any contrast studies will be in there. Medications, make sure, like I said, some of these charts or the packets may look a little different than some other ones. Okay, but they're all basically exactly the same. Okay, make sure you're filling out all of these. Medication name, generic and name brand. What is the classification? Dosage, route frequency. Okay, this should say oral. There we go. See? Dosage, route frequency. Reason for medication, and it could be an off-label use. Okay, you can be either you've learned about the pharmacology or you will, but it could be used off-label. And then nursing considerations or interventions. So what are we concerned about specifically with this medication and this patient you're doing your packet on? All right. And then for the narrative note, this is going to be a little bit different for different classes. If you're in the foundations, fundamentals class, all right, NR 155, or just in your foundation fundamentals, right, our first clinical class, I want you to get used to these packets. So for now, and because of the lack maybe of the information and being able to get into the charts, that's a good place to start either way is you can use S-bar. Use S-bar as your narrative note. Okay, so for the R, basically, I just really want you to notate the short-term goal for today's shift. So while you are here for today's shift, what is the short-term goal for this specific patient? Okay, well, make sure you're using your S-bar as your narrative note. Okay, I'll fix this. What is this? I think I missed the assessment here, didn't I? I'll put it twice. All right, well, we're doing this in real time. There we go. SPSR, all right, that didn't work out. S-bar, we're doing it right now. Yeah, we're human, we make mistakes. But you see here, just have your S-bar, and in the other clinical groups, and even in the foundations fundamentals class, you will all be receiving a narrative note, examples, and some tips. Okay, narrative notes will take a while to get good at, but you will receive some feedback when you submit your packets on your narrative notes. Okay, this is not something you have to perfect in one term. Okay, but please look at that email example for your narrative note. Please make sure though, and we'll do this here just so you can see it. Your date, time, your note, make sure you sign it. Make sure you sign it. Put your initials, and for right now, while you're in school, you can put SN for student nurse. Once you graduate past the board, you make sure you put RN everywhere. But for right now, for the purpose of these packets, make sure you put your initials and then RN, excuse me. Right? Please, any questions, let me know, but I'm hoping this walkthrough can kind of help you understand exactly what needs to be filled out, and you can just be a lot more comfortable with these packets. I really don't want it to be tedious, just want you to get used to it, understand what we're looking for, and make your life easier, hopefully, here going through this. So this is your student name, obviously your date. Okay, this is going to be where you're going to put your diagnosis. So your plan of care with interventions and goals. Now, for nursing diagnosis, you want to make sure you're applying your ABCs, Maslow's, the emergent issues of the day for that patient and put those in order. So for example, ABCs, obviously airway and oxygenation would be higher up on the list, right? Any circulation issues. So this is the order you'll put it in your ABC order or your Maslow's. Okay, but your diagnosis should be based off the admitting diagnosis, really, right? You want to make your nursing diagnosis that you're developing in some part based on why they're here. Well, that's what that means by based off admitting diagnosis. Okay, they could be here for chest pain, but they could have additional issues. Okay, that chest pain itself may be number one on your list, right? But they could have an additional issue with immobility. Okay, but that will not be number one. Your chest pain would. So you want to base it off the admitting diagnosis and then the top 3 patient concerns or the priorities of care. So basically the way you can look at it is look at the top 3 things we need to keep an eye on and pay attention to with this patient. Right, these are going to be important issues, right? Pertinent issues for this patient. And then you organize those into your ABCs and Maslow's. Okay, your interventions will have to apply to that diagnosis. Are you able to delegate them? And to whom, right? CNA, LPN, whatever it is. Your goals, you'll have short-term goals and your long-term goals. Now, your short-term goals should be, they're going to be what you're developing for this shift. So by the end of the shift that you're here for, what are your goals? And then the long-term is going to be, what are the goals by discharge for this patient? And the way we evaluate is we're evaluating that condition, right? Evaluating a short-term goal for that shift. Were they accomplished? Okay, you'll do that for all 3. Make sure you have diagnosis, interventions, goals, and evaluations, along with your delegation. Okay, are you able to delegate those tasks? All right. That'll be it. Remember, to get a passing grade on these packets, you have to have this client plan of care done and your narrative note done. Okay, you can have a perfect score throughout the rest, but if you do not have these 2 areas in here, you will not pass the packet. And it's going to change depending on class, how many you need to submit. Usually it's going to be at least the last 3 or 4 you need to have a passing score for. But please, any questions, contact me, let me know, contact your instructor, let them know if you have any questions whatsoever, okay, on these packets itself. Hopefully this helps. Quick rundown of what you need to kind of look for and fill out and what you need to do for these packets.